OK 大家好，你们应该看到我的屏幕 OK 我刚才呀在聊天里边发了，希望大家可以填写一些这个今天参加了，因为之前填过，只需要把你的名字还有你的电话打进去，我们就可以找到你了。OK 我们现在就开始 OK 今天大家想上来就是因为看到我这一个大家可以看到我的屏幕吗？如果可以看到我的屏幕，可以在你的那个 Zoom 里边也可以放一个 Yes， 还是也可以举手让我知道你看到，也可以在聊天里边打2个字，谢谢 Monica。OK， 所以大家都已经看到我的屏幕了。OK， 今天就是我们是第一个 session。OK， 因为我很高兴就是请到真的是 Social Security 办公室的这个联邦就是退休局的他们上来讲，他们Richard 他会讲3周，每个星期3 OK 就是讲所有你可以在 Social Security 办公室里边申请的福利 OK， 所以真的是非常一个很好的机会，希望大家可以问问题如果想到问题的话，不要说忘记了，把它打进去聊天里边 OK good OK， 所以 OK 这个是我是有录像的，我有记录这个讲座，所以因为有的人可能就是没时间去听我们就是会放上去 YouTube 的，可是问答的时候我会把它剪掉，所以大家可以很放心的去问问题 OK。基本上现在大家都是精英的 OK 如果中间有什么问题可以举手，我会去留意的 OK 也可以举手因为如果是关于他刚刚讲过的问题，大家可以去问 OK 不需要等到最后，这样子的话我们就可以就是把事情讲开，不用到最后的话又从头再讲 OK， 所以如果中间是有什么问题的话，大家是可以发问的 OK， 不需要等到最后 OK OK 如果是第一次上来的大家，我是 PCDC 的 OK， 我们是非盈利 OK 组织来的 OK， 我们不是政府部门 OK， 这个是我们以前办公室，可是我们现在都已经搬到这个高大厦，在唐人街的高大厦1001王安街 OK 2楼。我们有不同的服务，这个我也不说了，可以打电话过来问我们，如果有什么问题的话 OK。人口普查还没有做人口普查 OK， 我们是非常低的，才57吧，现在好像11月中了才57，我们还有2周的时间，真的希望大家帮我找一找，在你们的微信群里边问问还有没有谁是没有填人口普查，帮我们把这些没有填的填进去就是要求他们帮我们填，因为不填的话我们费成 OK， 你看到这里费成是非常低的，才50多%，那么就等于未来10年我们费成拿的资源是不够，比起其他那些城市是不够的 OK， 所以希望大家可以真的帮我找一些谁去填这个人口普查如果有人去敲门的，有一个袋子是 Census 的人口普查的话，麻烦大家开，可是也要谨慎的 OK， 因为他们可能有一些问题，就是你们填了之后他可能还是有一点问题，有的没填的他会要求你填 OK， 所以我有在微信里边已经发了这些就是一些我们放上去这个微信上的一些flyer， 所以希望大家如果还没加了，可以加进去我们微信群里边。来我这个我也不讲了。星期五我有一个教导 ECA 过来讲的，关于你怎么把家里的房子弄好，这样子冬天的时候就可以保暖夏天的时候可以保冷。OK， 他有一些小的技巧教大家，然后也有说有什么补助计划是可以帮你收房子的，所以是星期五的 OK， 然后我们现在每个星期五到10月份都会派这个15的 OK， 在我们中心里边 OK， 星期六这个我们改了，然后如果家里有高中生的好像说7年级到12年级的，我们现在是每星期2到星期5都，现在9月份还是晚上的 OK， 所以大家可以去留意一下 OK 我在微信上有发了一些说关于这个贷款现在有一些新的更新的你不需要你的收入失业金是不算在你的收入里边的 OK， 所以他们说的 30% 降低的，你就是只要你是失业拿到失业金，你都可以去申请这个贷款补助了 OK， 所以嘛如果是有问题可以打电话过来我们公司问 有些人说洗液精差不多没有了，怎么办？我也放到微信上了，所以麻烦大家看一下。OK，OK，那么我现在就是回去 OK，我现在就是跟大家就是 OK， 现在我就是把这个时间交给就是他是这个社会安全总局的 OK， 就是你们通常拿退休金 SSA 的部门，他是就这个社会事务专员。他之前如果有在我微信上面呢，我是有一张 flyer 说他们现在是关门的，是只可以打电话，可是需要捐躯的话可以跟他们预约的 OK， 都是他发给我的 OK， 所以大家有什么问题是可以问他我现在就让 Richard 他讲Richard I don't know how to pronounce your last name, so I will just let you introduce yourself. Okay, so
okay,
now
thank you. Okay. Well, good morning, everybody. My name is Richard Gaddiosi.
Okay.
And I'm here
他说大家好，他的名字是 Richard Gaddiosi.
And I'm here from Social Security, and we're going to talk all about Medicare.
他是从这个社会安全总局里边过来的，我们就是今天就会讲这个联邦医疗保险。
And I want to thank Ting and PCDC for allowing me to do this presentation. Thank you very much.
他说就是非常高兴就是感谢 PCDC 安排这个会。
Okay, so this first slide is just a picture of the new Medicare card.
Okay, 他说actually let me double check if they can see my screen because I just switched to PowerPoint. 大家可以看到我的屏幕吗？ 看到这个联邦医疗保险的这个屏幕吗？上面有一个卡，有没有？大家看得到吗？
And I say it's new, but it's about 2 years old. And the reason I say it's new, though, is because they used to have the Social Security number on the Medicare card. And about 2 years ago, they took off the person's Social Security number and they just gave it an ID number. You can see that number in the middle.
他就是说，他说的是新卡，可是这个卡其实也不新了，大概有2年吧。OK， 因为之前是有这个社会安全号在上面的。Sorry， 不好意思。它有一个社会安全号放在上面的 ，OK， 可是现在就是换了这个卡是没有这个社区这个社会安全号的 ，OK。我想问一下就是 Let me just make sure they see the screen 你们看到这个屏幕吗？因为我刚刚换了屏幕，所以我想确保大家是看到我的屏幕吗
？Okay, so this is just a sample card. It doesn't mean anything, the numbers that are up there, but it's just a sample of what a card would look like. Okay.
OK， 他就是说这个不是真的卡，这个只是就是让大家可以看到这个卡是怎么样的。大家so just wait Richard, I just trying to confirm 你们大家可以看到我的屏幕吗？可以就是举个手，还是 yes， 还是可以在聊天里边打一下。你们看到我的屏幕吗？
Okay, so Ping, we're going to go to the second slide now.
Yes, but I think just want to confirm. 你是看到一个屏幕，还是有两个图片？是一个图片还是2个图片啊
Okay, so
sorry, Richard, just 1 second. I'm waiting for the
response.
I'm waiting for the response. 你们现在是2个 ，OK， 那么我应该是要把这一个 OK，1 second, stop share. Share screen, second screen. OK， 现在应该是看到一个屏幕吧，对不对 ？OK， 好 ，OK，Yes， go ahead.
Okay, so Medicare is the federal government's health insurance program, and it's not run by Social Security. It's run by CMS, which is the Centers for Medicare and Medicaid Services. It's a different federal agency.
OK， 他就是说这个联邦医疗保险呢，它是这个跟这个医疗补助服务中心一起就是营运的这些保险。
So 2 ways to reach CMS would be to call 1-800-Medicare or to use the internet, and it's medicare.gov.
有2个办法可以联系他们，第一就是可以打电话给他们，第二也可以上去这个medicare.gov 的网站。
Okay, now what we do with Social Security is we are the agency where you start. You file with us, and we determine if you're eligible, and we get you enrolled.
他就是说他们协会安全局是做什么了 ？OK， 他们基本上就是他们是你如果想拿这个联邦医疗的第一站 ，OK， 你就是需要去跟他们就是他们申请啊，然后他们确定你是合不合资格然后他就是把这个卡发给你。
So once a person gets on Medicare, then all the questions about healthcare coverage and all that all goes to CMS. So you start with us, we get you on, and then after that, everything goes to CMS.
他就是说，你只是一开始的时候找他们，如果你已经参加了这个保险之后了，你就是参加了之后了，你就是找这个 CMS 关于你保险的问题。
And just before we get off of this slide thing, I just want to make the distinction between Medicare and Medicaid. Medicare is the federal government's program. Medicaid is a state-run program, basically and it's based on your income and some other things. So those two sometimes get mixed up, Medicare and Medicaid, but they're different.
Yes. 他就是说想去下一个屏幕之前，想跟大家就是说清楚 ，OK Medicare 联邦医疗保险跟那个 Medicaid。OK， 就是这个州政府的这个低收入者医疗是两个不一样的。它 Medicare 是联邦政府的，有 Medicaid，OK， 它是州政府的医疗的，所以两个是不一样。希望大家就是就是不要把它混在一起。
Okay, so Ping, we're going to go to the next slide. It says Medicare requirement.
OK， 他说去到这个医疗保险的条件。
Okay, we good?
Yes.
Okay, so to get Medicare, you have to either be a U.S. citizen or you have to be lawfully present in the United States, and you have to have lived here for at least 5 consecutive years. So those are the requirements: citizenship or lawfully present and here 5 years.
OK， 最主要有两个条件，第一就是你必须是美国公民，不然的话，如果你不是美国公民的话，你必须是在美国有合法身份的，然后连续就是在这个美国居住有5年的。
Okay, so next one, next slide.
Okay.
Which is 2 types of recipients.
OK， 他现在就是另外一个屏幕。
Okay, so the two types of Medicare recipients, you can either get Medicare based on your age, which is 65. That's where most people get Medicare.
他说第一就是有2种绿营的 ，OK， 可以拿到这个联邦医疗。第一种就是根据年纪的，就是65岁。
Okay, and the other way, people younger than 65, they can get Medicare, but they have to have a medical condition.
OK，
and be entitled. Go ahead.
OK， 他就是说第二个条件就是说可以是65岁以下，可是这个是根据这个病情的。
And they have to be either be entitled to Social Security disability benefits for 24 months, 2 years, or have kidney failure and also have worked a certain amount of time. So that's how you qualify if you're younger than 65.
就是如果是65岁以下有病情的话，第一他是就是有这个社会保障长职金的，必须是有24个月才可以。OK， 另外就是有一个就是可能是肾虚竭还有就是就是有保险的 ，OK， 还有就是需要有工作了有做过工的 ，OK 才可以。
Okay. So next slide, where you can qualify through your work.
OK， 现在就是说你就是第二个屏幕，就是说你可以通过工作去得到这个医疗。
Okay, so there's a couple ways a person qualifies. Primarily, people get it because they worked a certain amount of time.
OK， 就是有几个方法可以去得到这个资格的最主要的就是他工作够了，去拿到这个联邦保险。
So one requirement you can meet, most people do it this way, if they have 10 years of work, United States, 10 years of work and paid the Medicare tax while they were working, that would qualify you.
最基本的就是说你工作够10年，然后你还有就是有付这个联邦医疗保险税 Medicare 的税。
Or if they don't have 10 years of work, if their husband or wife has 10 years of work, paid the tax, and is at least 62, then you can qualify for your husband or wife.
还有另外一个条件就是说，如果你是没有工作够 ，OK， 可是你的配偶你的太太还是丈夫是有62岁，然后有10年的工作历史的话，然后也有付这个联邦医疗保险税的话，那么这个也是可以得到。
Okay, Ping. So next slide, which is for people who don't have enough work.
然后这一页就是说，如果没有不足够的这个工作的话，怎么办呢？
Okay, so if a person doesn't have 10 years of work or the spouse doesn't, you can still get Medicare. You can buy it, but it can be very expensive.
OK， 如果是你没有足够10年的工作的话，你还是可以买到这个联邦医疗保险的，可是就是非常贵。
Okay, so next slide. We'll talk about that too. We'll talk about how much it costs in just a bit.
我们等一些就会说是需要多少钱的。
Okay, so Ping, next slide about the payroll tax.
现在这一页就是讲关于这个生机税。
Okay, so people who are working in the United States, they have a Social Security tax and a Medicare tax they pay.
Okay, 在美国工作的人，他们其实除了其他的税，还有2种税，就是社会安全税 （Social Security），然后还有另外一个是这个联邦医疗保险税，就是 Medicare。
Okay, and when you do this work, this is what we're talking about. When you work and you pay in, this is how the main way a lot of people get qualified for Medicare.
所以这个是通常你工作的时候这个也是最主要的就是条件去得到这个保险。
So today the Social Security tax is 6.2% of a person's earnings up to $137,700. If we reach that amount for the year, then they stop paying the Social Security tax.
OK， 就是现在来讲的话，这个社会安全税是6.2%。OK， 就是如果是13,700以下的话，就需要付这个6.2% 的税。如果就是过了13,700以上的话，这些钱就是不用交这个社会安全税了。
And then we talked about this already. When you're working, you also pay a Medicare tax, which is 1.45% of your earnings, but there's no limit on. It's not limited to $137,000. Somebody made way more than that, they still pay the Medicare tax. So that's what we were talking about, paying into the Medicare.
然后就是还有一个联邦保险的税 ，OK， 现在是1.45%，这个是没有上限的。所以如果你是不管你的收入多少，这些税的1.45%还是要交给这个联邦医疗保险。
Okay, so next slide thing where it says paying the FICA tax.
然后现在这个页就是说付这个税。
Okay, so when you work and you pay the tax, you're earning what's called credits, and you need a certain number of credits to qualify for both Medicare and Social Security.
OK， 就是当你工作的时候，你付这些税的话啦，这个 FICA 的税的话，你是可以占这些点数，占到这些点数，你才可以享受这些有一些退休的福利。
So this year, when a person works, they earn 1 credit for each $1,410 of earnings that they have.
如果这个人就是如果占1410块钱的话，他可以占1个点数。
But no matter how much a person earns in a calendar year, they can only earn 4 credits. So as soon as a person has like $5,640 of earnings for the year, they have their 4 credits, and that's all they can earn in any 1 year.
然后不管你赚多少钱 ，OK， 你最多只可以就是得到这个4个点 ，OK， 所以就是如果你是5640块钱，你就可以拿到四个这个点 ，OK， 不管你之后再多少钱它还是4个点。
So there you see at the bottom, people need a total of 40 credits to qualify for retirement Social Security. Okay, so basically we say 10 years of work, because you can earn 4 credits in a year for 10 years. That gives you the 40 credits that you need for Social Security benefits. Okay.
如果你是需要拿到退休的福利的话， 他们通常就是说你需要40个点，不是学分，是40个点才可以得到，才可以推收。
But the rules for Medicare are a little different. You can qualify either through the work, through the 40 credits, or you can also buy it. We're going to talk about that. You can buy it if you don't have the 40 credits.
OK， 他就是说，可是整个联邦医疗保险的话，就有不一样的、不同的规则啊。你可以是根据你工作去拿到，可以根据你有40个点就可以拿到，然后你也可以买的。
Okay, Ping. So next slide, which is the 4 parts of Medicare.
然后现在就是说这个联邦医疗有4个部分。
Okay, so there's 4 parts to Medicare: A, B, C, and D. And A and B have been around for a long time. C and D are newer parts. We'll talk about it.
就是有4个部分，有 A、B、C、D， 然后 A 跟 B 是做了很久了，已经 C and D 就是最近才有的。
So A is hospital insurance, where if you have to stay in a hospital overnight or some other facility, that's where that would come in.
OK， 它 A 部分呢，就是这个医院的保险。OK， 基本上如果你要进医院要楼院还有就是去其他的，只是它就是这个保险。
And then Part B is medical insurance. That's what you use if you go to the doctor's office. You're not staying in a hospital or anything. You're just going for a test or an examination, and you're not staying. That's where Part B would come in.
然后 B 部分呢，就是医疗保险这个不是说你楼院进去医院的，就是如果你看医生做一些检查这些就是就是这个医疗保险。
Now the Part C and D, these are like extra coverage you would get through an outside company. You would decide whether you want this or not.
然后它有 C 跟 D， 这个其实就是你另外跟其他一些保险公司去拿的 ，OK？ 你自己可以确定要还是不要的。
So C and D, we're going to talk about that, but Medicare Advantage is like healthcare, medical coverage, and Part D is the prescriptions. But we'll talk about those too. But that's what that is.
OK， 他说 C and D 的话，这个就是等一些他会再说了 ，OK？C 基本上也是医疗保险来的 ，OK， 然后D 就是处方药的。
Okay, Ping. So next slide, about Part A. We'll just talk about Part A.
OK， 他就是现在这个先讲就是 A 部分的，我这个没有翻译，我刚才翻译到上一页就没时间了 ，OK，so I just telling them also this is the slide that I don't have translation from now on，OK，所以大家就so they have to really pay attention to what I speak。这个就是医疗现在 A 部分就是关于这个医疗保险的。
Okay, so Part A, as we said, is for hospital insurance. If you're an inpatient at the hospital overnight, or maybe at another facility where you stay overnight, that's where this would come in. But it's not people in a long-term nursing home. This does not apply to them.
Okay.
So it's just like if you're staying overnight at the hospital at Jefferson or wherever,
So it's just a temporary, not like a long term.
Right. It's just while you're hospitalized. That's all.
OK，这一部分就是包含就是你住院 ，OK， 在医院里边住院还是其他的这个地方的就是需要留意住院的。可是如果你是去这个养老院这些啦，就是不包括在内的。基本上刚才我也说，就是这个是暂时的，不是说一个长久的。
Okay, so hospital insurance, when you get Part A, it's free. You don't have to pay for it when you get it if you have 40 credits. So you got to have the 10 years of work for it to be free.
OK 这个 A 的话是免费的，如果你是有这个40个那个点的话，你就这个是完全不用付钱的这个 A 部分。
And if you don't have the 40 credits, then you're going to have to pay for it. And this is where I say it's expensive. The Part A is expensive. It's either going to cost either $252 a month or $458 a month based on how much work you do have. If you don't have 40 credits, it varies how much you would pay.
它就是说，如果你没有40个点的话，有可能是252块钱，也可以是458块钱，根据你就是工作了多久来算的。
And also, if you don't have the 40 credits, not only is it going to cost more, but you got to file at a certain time. Otherwise, you're going to pay even more. And you also got to have Part B. So that's not a big deal right now, but just wanted to throw that in.
他就是说，如果你没有40个点啊，你除了你需要付钱252还是458。另外，如果你不是在它期限里边去申请的话，有可能还要付更多的钱。然后他说还有就是你怎样子买的话，你还是需要拿到这个 B 部分的。
Okay, so the next one is Part B, the medical insurance. Okay.
然后 B 部分就是说这个医疗保险。
Now this covers, as we said, outpatient procedures. You just go to the hospital, get a test, and come home same day. Or if you got to get medical supplies or see the doctor, that's what this is about.
然后这个是包含这个门诊的手术 ，OK， 就是基本上就是你预约了，然后就去里面做一个小手术啊，不需要住院这些的话，还有就是拿一些医疗的这个用品。
Now for Part B, you do have to pay a premium every month. Okay, Part A is free pretty much if you have the 10 years of work. Part B though, even if you have 10 years of work, you still actually you don't need work credits at all for Part B. It's $144.60 a month.
然后 B 部分的话呢，不管你是有工作没工作，有没有40个点，它就是必须要收你144块6毛钱，这个是一个常规的每个月的这个付钱不管你的okay. So I think just want to make sure. So if the high income, they pay more, right?
Right. If your income is over certain levels, like $85,000 for the year for a single person, you're going to pay more than $144.60. That's you're definitely the standard or minimum amount is $144.60 right now.
Okay. 他就是说这个是常规最低的是144.6。OK， 可是如果你收入是8万以上的话呢，可能就是需要付更多了这个不管你多少个工作点 ，OK， 都是需要付这个钱的。
Yeah, and just like Part A, you don't need to have the 40 credits. But one good thing is you won't pay more. If you're 65 and you don't have 40 credits, you can still get Medicare Part B.
OK， 就是他就是在说了这个就是跟 A 部分一样的，你不需要就是有40个点才可以申请的 ，OK 因为这个就是需要付钱的。
Okay, so next slide is about the Medicare Part C, Medicare Advantage.
Can I actually just Richard, can I for that slide? So I always heard that client was telling us that they deduct some premium from my Social Security retirement.
Right.
So is that usually for Part A or for Part B?
That's Part B. No, Part B.
Okay, so they can actually
you get Social Security benefits and you have Medicare Part B, automatically it's going to come out of the check.
Unless they have Medicaid, right?
Right, unless they have Medicaid, the state is paying for them, then the state pays the premium, then they're getting it for free because Medicaid's taking care of it, right?
Okay， 因为我就是问他，因为我们有时候客人就是说他的退休金每个月他就是这个 SSA 都从他退休金就是扣了一些钱去付。我问他是 A 还是这个是哪部分的，他说就是 B 部分这些钱来的 ，OK 可是如果他们是申请到低收入的这个医疗，做政府的医疗就会帮他付这个B 部分的钱 ，OK good. So I just want to clear that up. So we on the next slide about the Advantage plan. OK 现在就是这个 C 部分的。
So the Medicare Advantage plan, most people feel that just having Part A and B alone is not enough to cover them. So they need to go out and get some additional coverage, and that's what Part C is.
OK， 这个 C 部分就是他们很多人说这个优势计划有这样就是因为 A 跟 B 都不足够去包含他所有的医疗的服务还有费用，所以他们就另外再跟一些私人公司去得到这些额外的这个保险。
So when they, and this is a choice that this is not something a person has to do, but like I said, most people do it because they need the extra coverage. So they would pick a private company, could be like AARP or Cigna or Humana or whomever, Blue Cross, and they would get this extra coverage, and they would usually get prescription coverage with that.
他说这个是有选择的 ，OK， 你不一定需要去拿到这个 C 部分的 ，OK， 可是有些人就是真的想着更多的福利的话，他们可能去参加这个 AARP 啊 Cigna、Humana， 还有就是蓝十字，就是他们去得到22的保险。
And usually when you sign up for Medicare Part C, you're in a HMO, and where you're in a network, you're going to have to use a certain doctors or certain medical facilities that are in that company's network.
如果你是有这个优势计划了，通常你就是有一个叫 HMO 的计划，就是规定你必须在他们网络里边的去找这些医生还有服务。
So you still have Part B, and you still have to have that premium of $144.60 paid, but now you're going to have to pay some additional money to this company. And in theory, you're going to have lower out-of-pocket costs, and you're going to have more services covered because you got more comprehensive coverage. But you're going to be paying in two places for this.
然后这个 C 部分呢你还是需要付这个B 部分的那个月费，然后还有这个 C 部分呢也有一个月费可是就是付了这些费用之后，你可能每一次去看医生呢，还是其他的，你可能就是付更小的钱，因为他们所包含的服务可能是更多。So I just want to actually also make sure actually for these companies, sometimes they do offer zero premium plan, right?
Right, correct. Yeah, a lot of times they offer that in the beginning, and then people sign up, and then maybe later on that might change. But you're right. You're exactly right.
OK， 我就是跟他说 ，Yeah， 我就是跟他说，他刚才说这些 C 部分，如果你去这些保险公司是有这个月费的。然后我就是跟他提一提，就是说有很多人其实这些保险公司，因为如果你是有政府医疗的话，他们就把这个保费也是可以零保费的 ，OK， 这个费用可以是零保费的，也不用付钱，可以达到这个 C 部分。然后他就是说，通常一开始他们会这样子的 ，OK， 所以你是每一年都要去跟他们沟通，看看这个保费是不是零的。OK， good， thank you.
And then usually thing when somebody goes to the doctor's office or the hospital, they would show this card for the company card because everything Medicare A and B is all wrapped within the Part C card, you know?
OK.
So they would show that card usually.
OK. Yeah, 如果你拿到这些优势计划的话呢，如果看医生呢，去医生诊所这些医院呢，都是只需要付这个 C 部分的这个他们说的白卡。OK， 你就不需要再拿这个红卡 ，so they don't need to show the Medicare card, right?
Yeah, usually they don't. They would show this company card, the Part C card, because everything's wrapped within there. So,
OK, yeah, so 他就是说只需要给这个 C 部分的卡就可以了，不用给哪个红蓝卡了。
Okay, so next slide thing on Part D, the prescriptions.
然后这个 D 部分呢，就是关于这个药的拿药的涵盖。
So a lot of times the Part C plan has prescriptions, as we said. If so, then you don't have to worry about Part D, but sometimes they don't, and you have to go pick a Part D plan.
通常如果你有4部分的这个优势计划的话，他们都已经包含了这个药的这个涵盖所以如果是私人公司都有的，可是如果有些是没有的话，你就是自己要拿这个 D 部分的。
So Part D is similar to Part C. You would pick a plan. It's up to them to pick a plan from a private company. Again, the same type of thing. Could be Blue Cross or whatever. You would pick a plan, and you would enroll directly with those companies. You know, once you're entitled to Medicare.
所以雅思跟刚才 C 部分一样的 ，OK， 雅思可以选一些私人的公司 ，OK， 然后他们就有就可以让你参加这个药的保费里边。
And then at the bottom, the one thing Social Security has is a program called Extra Help, where if somebody has low income and limited assets, they can apply to get extra help, which means they wouldn't pay as much for their prescriptions.
然后就是说，他们社会安全局，他们其实有一个计划是叫 Extra Help， 就是增加了帮助 ，OK， 就是给那些有限的收入的，还有资产的人可以申请让这些药的费用就是可以降低的。
If somebody let's say somebody's on SSI, they automatically get this extra help. Just like you said before about the state pays their premium. Same thing for people with SSI. They get these things automatically.
So they don't need to apply, it just automatically.
Right, they don't make you apply. If you're on SSI, you automatically get the extra help.
OK， 他就是说，如果你是有 SSI， 就是社会安全补助金吧。OK SSI 你就自动已经达到这个叫 extra help 的计划里边，你就是不需要申请，它已经自动把你放进去这个计划里边，所以你拿药已经是比较低的了。
Okay, Ping. So next slide is just about the people who don't want to be in the network, don't want to be in an HMO.
写一个就是说，因为有的人不想是有一个网络，就是困在这个网络，只可以选这些医生的话。
So like we said, Part C, you're going to be in a network, and then sometimes people don't want to be in a network. People want to go pick and choose whatever doctor they want. So they would not sign up for Part C then.
OK， 如果就是有些人就是不想参加 C 部分，为什么？因为他们不想就是锁在一个网络里边的医生，就是里边的那些provider。
So what those people would do, they would purchase what's called a Medigap policy. This is called supplemental insurance. And they can go to any doctor that would take that be covered by that company. So people have more freedom with the Medigap policy, but you got to have Part A and B to do this.
他就是说可以购买一个就是这个gap，OK， 就是中间的就是有一个保险 ，OK， 叫 Medigap 的政策 ，OK， 这个就是提供一个附加的保险 ，OK， 可是这些你可以不买你不买 C 部分，可是可以买这一个保险可是你必须有 A 跟 B 的部分的。
And then you'd have to, in this case, you would have to purchase a Part D plan to get prescriptions, okay? Because the Medigap policy doesn't have prescription coverage.
可是这一个 Medicare 的政策就是没有这个药的，所以就是必须要买一个低部分的这个去包这些药费。Okay, so can I just so
yeah.
You said they have to if they buy the Medicare policy, so they
right.
The provider they choose has to accept the Medicare policy, right?
Yeah, the Medigap policies, I think there's 12 of them. They're all the same all throughout the United States. And they're identified by letters, like Medigap K, Medigap G, whatever. And they're all the same. Like Medigap G is the same in Pennsylvania as it is in California. But the company you pick can charge a different amount. So you have to do your homework there before you sign up.
Okay, well,
so you would pick a Medigap policy from a company. And then you would also go get a Part D plan to get your prescriptions covered.
Okay, but then
if they want to do that. So Ping, everybody pretty much is going to have A and B. And then it's just a matter of whether you want to get Part C or whether you want to get a Medigap policy with a Part D plan. That's pretty much the way it works.
Okay. 我就是刚才就是问这些，然后你就说你拿到这个 Medicare 的这个保险，你还是需要找一些就是会接收这个保险的医生还是诊所才可以去看的。OK， 他都是说如果 A、B 基本上每一个人都有的，要 C， 如果你不想要 C 的话，你就可以选择这个Medigap 的这个保险。他说这个 Medicare 的话基本上是全国的就是有的可能在这边是跟这个加州的也是一样的。
Okay, so we've covered a lot of stuff. Everybody doing okay so far with all this? A lot of stuff.
我们现在讲了很多，现在大家还是可以有没有问题？So actually, let me just read. I think you're gonna talk about the enrollment period later, right?
Yeah, we're coming up on that now. Yeah.
Okay. So so Monica, we'll so Monica, so your question will be answered later because I think Rich is gonna talk about the enrollment period. So we will address your questions there. So we do have somebody asking just about the eligibility. So I want to address it now. So it's a 90 years old senior. Permanent residence for more than 5.5 years, never work, no income. Can they apply for Medicare?
Well, they can. You said they never worked in the United States?
Yeah, never work.
Okay, so they can apply for Medicare, but remember, the Part A, is going to cost them, it's going to cost them almost $500 a month unless the state pays for them. If they're low income, the state could pay that for them. Part A. And Part B, they can get if they want. That would just be the regular cost of $144.60.
Okay.
So they can definitely apply for B. And A, they can either pay it if they want to pay that amount, or if they're low income, then the state might pick up the whole both A and B for them.
So should they apply
they should definitely check with us, is what I'm saying.
Okay. Yes. Okay. So should they also, should they apply for Medicaid first, or should they apply for Medicare?
Well, no. Yeah, I guess it depends, because it's sort of like one or the other. But I mean, it might be good for them to touch base with us, because you can file for Medicare with us and just say, I only want Part A if the state picks up the cost. We can do that on an application.
OK， 他就是说针对这个问题，我看到 Kitty 里他有一个问题，90岁老人就是入卡5年半，没有工作或没有收入，是不是可以申请 Medicare？ 他是说可以的 ，OK。可是正常情况来讲，如果是这个情况的话，就是只是 A 部分都已经500块钱，然后 B 部分就是144块钱，除非 OK， 除非州政府可以帮他，州政府的 Medicaid 可以申请到，然后帮他付这些保费的话，他可能就不用钱 ，OK 然后你里边的问题说如何申请，需要什么材料，所以Rich 就是说可以跟他们社会安全局联系，然后他们会教你怎么做。我刚才也问他一个问题，那么他是应该是先申请州政府的医疗啦，还是申请这个红蓝卡联邦政府医疗？他说其实哪一个都可以 ，OK， 你可以跟他们就是社会安全局先申请 A 部分的 ，OK， 然后就是申请 ，so no matter whether they have Medicaid, the Part A, they still need to pay for it, right?
Well, again, what we'll do, we'll take an application for Part B, and we'll put in the remarks of the application that I only want to get a Part A if the state is going to pay for it. Meaning they're not going to pay that big cost on their own. So we can do that. We can take the claim and just like hold it until we see what's happening with the state.
OK, understand. OK， 我觉得他就是说了 ，OK， 申请的时候你可以跟他说 ，OK， 你需要这个保险，除非州政府帮你付，如果州政府不让你付的话，你就不需要 ，OK。所以你是可以跟申请的时候，他们是可以在申请表里面写，如果州帮你付这个钱的话，你才需要的 ，OK。所以就是可以跟他们联系，如果你需要申请州政府医疗的话，可以打电话给我们公司，我们是有帮人申请州政府医疗的 ，OK。So I will also share the flyer that you sent to me before, so they have the phone number to call.
Yeah, and also ping. I mean, if a person doesn't, it hasn't worked at all. I mean, the question is, if they don't have any income, they should be applying for SSI, because if they get on SSI, then all this stuff will be paid for, the Part A and the Part B.
So that's why I will be looking forward for your presentation for SSI. There's a lot of understanding, thinking if you're permanent residents, you cannot get SSI. Okay,
right, SSI, you got to be a citizen. You have to be a citizen, or there's certain other categories you can be too for SSI. But what I'm saying is, though, if this person you're talking about has been here, you said they've been here 5 years, so they would meet that Medicare requirement. They could potentially have some chance to either have this paid by the state or SSI or whatever. So, okay, we'll talk about that. Yeah.
他刚才就是说，如果你是老年家，然后5年半，其实也可以。他就是刚才提到这个 SSI， 就是联邦的补助金 ，OK。然后我就是跟他说，所以我就是非常期待他下2周会说的这个 SSI 的主题，因为我们社区有很多人就是说。如果你只是入卡的话，你是没办法申请 SSI。其实他说还有其他条件是可以申请的 ，OK。所以我就现在就是不讲这一个楼带之后的 ，OK。可是，所以我应该是回答了 Kitty 的。我有一个 flyer 在微信里边之前发过的，是关于这个社会安全局的电话号码，我等一下会在微信里边发了。Okay, so I think we should just move on. I saw that some
Okay, yeah, right.
Move on, yes.
Yeah, you're correct. No, you're correct. Very good. Okay, next slide thing, which is about just a little reminder before you sign up for Medicare, you got to remember these two things.
OK，就是现在这个我跟他说，因为时间不太多，所以我们就接着下去。他就是有一些提醒大家，就是如果你申请这个联邦医疗的话 ，OK，yes。
Okay. So remember, Part A, if you have the 10 years of work or your spouse does, then it's going to be free. Okay.
So it's just want to confirm 10 years of work, but not the 40 credit, right?
Well, no, the 10 years of work is the 40 credits. That's what. Remember, you can get 4 credits a year.
Yeah, but you know
So
what? But sometimes people misunderstand because maybe the 1 year that they only work a quarter, or they might have only 2,000. They might not get the whole full credit.
Well, that's true. I mean, the bottom line is when I say 10 years of work, I'm assuming you have the 4 credits each year. So you're right. You could be here and you could be working in and out for 10 years and maybe only have 35 credits or something. So you need 40 to have not pay a premium for Part A. Yes.
OK， 我刚才他就是想提醒大家，第一 A 部分通常都是不需要付费的。OK 如果你是工作，他说的是工作10年，可是这个10年就是提醒大家，有很多人以为10年就可以拿到，可是他们有的人1年才报税报2000块钱，这样子他只可以拿到1个点。他的理解就是10年是必须有40个分，40个这个点才可以的，就是10年的工作。Yes.
Okay, so Part B, you always have a premium you have to pay every month, and if you're coming up on 65 and you're working, that sort of determines when you take Part B. We're going to talk about that.
Okay. 然后 B 部分呢，它是有月费的 ，OK， 然后根据你的工作情况去判定你是什么时候可以拿到 Part B， 它等一下就会说了。
Okay, so next slide thing about when to take A.
Yes.
Do we have some people who are? You think we have some people on the line who are under 65?
就是他想问一下大家，有没有人是现在是65岁以下的？有没有谁可以举手？也可以放一个 yes。然后也可以在聊天里边说一下 I'm just waiting for some response from them。有没有人是65岁？So there's 1, 2. So you're talking about 65 and under, right?
Yeah, right, correct.
Okay. So I have two yeses and 1 raised hand. So I have 3, 4. So we do have some people that's under 65.
Okay, very good. Okay.
Yeah.
So this will apply to them. So the question is, when do you take these Part A, Part B? So Part A, you should contact Social Security and enroll. You got to file an application in the 3-month period before you turn 65, and then your coverage will start right with your 65th birthday month if you apply in those first 3 months before 65.
他就是说什么时候去申请这个 A 部分的联邦医疗保险他就是说，如果你65岁生日了，哪一个月之前3个月就需要联系他们去参加的话，那么你就是you said if the coverage start on the birthday month, right?
Correct. Yes. Doesn't matter when your birthday is. It starts the first of the month.
Okay.
So if your birthday is August the 15th, it starts August 1st.
Okay. 他就是说，如果你的生日是8月15号的话，如果你8月15号之前8月之前3个月 ，OK， 8月之前5、6、7月份去申请的话，你的这个 A 部分就是从8月1号开始申请就是生效，就是从你生日的哪一个月份开始生效。
And the only exception to this is if somebody's working and they're participating in what's called an HSA, a health savings account at work. I don't know if anybody's out there who's younger than 65 who's doing that, who's in an HSA. Do they know?
I don't think a lot of our population have HSA, but I will mention.
Okay, all right, okay. Well, all right, we'll go past that then. Okay.
他就是说有一个例外，就是说如果你工作里边有一个叫 HSA 的账户里边，就是有一个健康全储蓄计划 ，OK HSA。如果你听不明白，可能你们就没有了。我也跟他说，我们的基本上不是有很多人有这个计划。
Okay, so Ping, we're going to skip over the next slide then about Part A and the health savings account. We'll skip that, and we'll go to when to take Part B.
So we take this, we will just go to OK。现在就是去到什么时候去申请 B 部分的。
Okay, now remember, Part B has a premium amount that you have to pay, so you have to be careful when you sign up. You don't want to sign up too soon. You don't want to sign up too late, okay?
就是 B 部分呢有一个规定，就是你不想太早申请，也不想太晚申请。
Okay, so if a person's coming up on 65 and they're not working, okay?
他就是说，你差不多65岁，可是你们还没有工作了。
So if they're not working and they're not on Social Security, then they need to file an application for Part B.
如果没有工作呀，没有退休金的话，你是需要去申请 B 部分的。
If they're on Social Security, you know, they filed maybe 62, 63, 64, whatever, then they don't have to do anything. A Medicare card will be sent to them in the mail automatically.
如果你是可能62、63、64岁，已经是拿到这个退休金的话了 ，OK， 这个联邦医疗卡就会自动寄给你的。
And then when they get the card, if they want Medicare, they just keep the card, they sign it, and they're covered as of the month they turn 65.
然后如果寄到家的话，这个卡就是你签字，然后就是等到你生日的哪一个月就可以用了。
And now, if they're not on Social Security, though, like they're 62, 3, 4, 5, now they're coming up 65 and they haven't filed for Social Security and they're not working, we don't know that they're out there. So they have to come forth and file in a certain period called the initial enrollment period. We're going to talk about that.
如果这个人是没有退休金的，所以他们退休局是不知道这个人的话，这个人就是需要在特定的时间去申请，他们就是叫做这个开始申请的期限。
Okay, so Ping, next slide is taking Part B when they're not working, when they're coming up on 65.
如果你65岁是没有工作了，你申请这个B 部分的。
Because we'll talk about if they're working, we'll talk about that in a couple slides. But for now, this is people not working.
我会说哪些如果是还在工作的65岁的话，现在先讲哪些没有工作65岁的。
So there's an enrollment period that they have to, you know, file in. It's a 7-month period, which is 3 months before you're 65, the month you turn 65, and 3 months after. That's the enrollment period.
所以如果没有工作65岁的话，有7个月可以去申请，就是你生日的哪个月份之前3个月，生日的哪一个月，还有之后的3个月，所以加起来就是7个月的。
Now, even though there's 7 months in the period to enroll, when you enroll, what month you actually do your application is going to determine when your Part B is going to start.
然后他就是说，根据你申请是在哪一个月申请的话，这个就确定你这个 B 部分是什么时候开始。
So if somebody wants their Medicare B to start right the month they turn 65 right on time, they need to enroll in the 3 months before they turn 65. So, you know, if their birthday's in September, then they would have June, July, and August would be the 3 months they would enroll and have it start right in September.
他就是说，如果你是想你生日的时候已经是保险生效的话，你就算如果你是9月份生日的话，那么你就是需要6月、7月、8月这3个月里边去申请，这样子他就会在你生日的哪个月开始。
So if they wait till the month they turn 65, then it's not going to start until the next month. It's going to get pushed out 1 month.
如果你是生日的哪个月份才去申请的话，你这一个月就是没有的，要等到下一个月才开始。
And then the same thing keeps happening. If you enroll the month after you turn 65, it gets pushed out now, not 1 month later, but 2 months later. And if you enroll in the last 2 months of your enrollment period, if you wait till then, it's going to get pushed out 3 months later. So that's the thing you have to be aware of. The later you file within the 7-month period, the further out your Medicare is going to get pushed out to start.
如果你是在65岁之后的才申请的话，几个月申请的话，如果你是2-3个月之前，就是大概它是就是2个月之后才可以生效。如果你是再过几个月的话，就是3个月之后才生效。
Okay, so Ping, next slide says taking Part B when not working.
现在这个也是说65岁没有工作了，这个 Part B 的话。
So if a person didn't sign up during those 7 months, sometimes people say, well, I'm healthy, I don't take any medicine or anything, I don't want to sign up and pay for it. So if you do that, though, you run a risk.
他就是说有些人说我非常健康啊，我不需要申请了 ，OK， 然后7个月都过了，然后都没有申请，这个是有很高的风险的。
So let's say your 7 months ends in August and you didn't sign up, and then 2 months later you get sick. You have to wait until the beginning of the next year, January, February, March period. That's the general enrollment period. You must wait until then before you can sign up.
他说，如果你是过了7个月都没有申请，就像如果你是8月生日了 ，OK， 可是你9月份病了 ，OK， 没有医疗的话，你到时都没办法申请，因为你要等到下一年的1到3月才可以去，就是一个给大众去申请的期限。
And what's going to happen too is your Part B is not going to start right away. It's not going to start until July. So you could you're going to get pushed out a good period of time.
然后，如果你就算1月到3月份期限去申请的话，你的整个生效期要到7月份才生效的。
And sometimes, not only is it going to get pushed out, but sometimes you have to pay a penalty the rest of your life, a premium penalty of 10% for each year that you waited. So instead of paying like $144.60, you're going to pay like $149. I'm sorry, $159. It's going to get pushed out by 10%. So that's the danger of not filing during your initial enrollment period.
也他说还有就是，如果你晚了之后，他还有可能罚款，每个月罚款就是加10%在你的保费里边，就是原来说144，他们可能就是收159块钱一个月。
Okay, Ping. So next slide. This is for people who are working at age 65. They're continuing to work.
现在这个页就是说，如果65岁还在工作的啦。
So those people, if they keep working and they're covered by their employer, they're providing health care coverage from their employer, they can delay enrolling for Part B. They don't have to worry about any penalty because they're working and covered by the employer.
如果这个还做工作，然后这个雇主是有提供医疗的话，他们可以要求延期去参加这个 B 部分的，是没有罚款的。
So once that person does stop working at a certain point, they have 8 months to file, and there's no threat of any penalty. So they could be 66, 67, 68, 70. As long as they've been continuously working from 65 on, they can, whenever they stop, they can have 8 months to file and get on, no penalty.
Okay. 他就是说，如果这些人就是到最后没工作了，这个保险已经停掉了，他们是有8个月去申请的。
And then sometimes people think if they have COBRA coverage or retiree coverage, they stop working and they don't have to file right away. That's not true. Having retiree coverage once you stop work, or having COBRA but you stop working, that doesn't give you extra time to file. You're still bound by the enrollment periods.
他就是说，有些雇主 ，OK， 就算停工之后，有一些就是叫做 COBRA 了，还是有一个是退休的保障 ，OK。也就是说，你有这些保障的话，他们也不会给你特别就是8个月他不会给你更多的时间去申请的，他就是有限是8个月之内要申请。
Okay, Ping. I think the last slide is the next one, which is a page from our website, socialsecurity.gov.
OK， 他现在就是这个这个屏幕，就是说，其实他们里边有一些是有一些中文的材料的。
We have a lot of publications in a section called the Multi-Language Gateway. We have a lot of our publications in Chinese, so people can get the information in Chinese for a whole bunch of different things.
它这个网站上面有不一样的这些材料是中文的，所以大家都是可以想去看这些资料的。
So Ping, that's the end of the presentation. I mean, I know it's a lot of stuff for people. So if they have questions, we can talk about it or whatever you want to do.
OK， 他就是说基本上就是今天就是到这里了。OK， 所以就是如果大家有问题的话，可以问。So there's some questions on the chat. I think
Okay.
it's mostly is about when to enroll. So actually, let me
Okay.
just read through the questions. So, he was okay. So, okay. So I think Monica's question is the father want to apply Medicare Part B for special enrollment. He was under the mother's or the wife work health insurance.
Okay.
Okay, so the wife is no longer working on August 2020. Both of them need the form signed by the mother's employers. So the employer signed the form but refused to sign one for the father. So what can they do to show that they
Wait,
had health insurance?
I'm sorry. You said the employer signed the one form,
So
but
they
wouldn't
have a
sign it for
form.
the
They have a form called CMS
right.
L564 forms.
Right.
So the employer is willing to sign for the mom, which is the employers, but they refuse to sign for the spouse. So what can they do to show that they had health insurance in order to qualify
Okay. Well,
for special enrollment?
the spouse was covered by the employer.
Yes.
Why are they not? Why are they refusing to do that? Doesn't make sense.
Okay. It doesn't make sense. So
Well, I mean, it doesn't make sense. There's no reason for them not to do it. If the spouse has been covered through the working wife, it's just a form saying that they were covered. That's.
mhm.
I mean, they can report that to us. We'll look into that, but that doesn't make any sense.
OK，所以 Monica 她的问题就是说，可能他们原来是有这个雇主的这个保险，可是已经没有了，所以他们去申请这个联邦医疗的时候，就是有一个特别参加的期限，可是就是他们需要雇主签一些文件，可是雇主不愿意签一个，可是不签第二个。所以他就是说，其实可以跟他们安全报去跟他们说，然后他们可以去做一个调查。Okay. So I think we talk about the credit. So I think
Okay.
I just want to clarify. There's people asking, so they're unemployed. Okay, does that mean that they don't have credit?
I'm sorry, people. I didn't hear what you said. People what?
Because of COVID, so people are not people are unemployed right now.
Okay.
So does that mean that they don't have credit?
Well, if they're not working at their job, they're getting unemployment. I mean, they're not getting any credits during that period of time, but did they have them? I mean, the credits we just count all throughout your life. It doesn't matter when you did the work. So, I mean, if they had 10 years of work
but for
prior
this
to going
year,
on
they probably
unemployment.
don't have. But this year, they probably don't have the credit for the time.
Right, correct. If they don't, right, they're not going to. Yeah, right. They're not getting anything this year towards the 40 credit count. Yeah.
Okay, just want to clarify because I know people are receiving the unemployment compensation.
Right. Yeah. No, unemployment is not going to give you any credits. No.
Yeah, because there's no FICA tax, right?
Correct, and you're not working at a job. Yeah.
OK， 就是林荣他有一个问题，就是说，如果现在都10月的话，是不是没有点数就是再看一些，你说贷半年，所以你应该有贷半年，有小半年还是有工作了，只要你的小半年如果有5000几百块钱的话，你还是有点数的。可是失业金 ，OK， 跟大家说，失业金是可以去报税的，是需要去加进去你的收入报税的时候。可是因为失业金就跟他刚才说的是没有打这个FICA 的这个生字税 ，OK， 所以这些失业金是不可以算作点数，是没有点数，没有点数的 ，OK。
And Ping, we haven't talked about it, but if people create an online account, my Social Security account, they can see for themselves. They can see how many credits we have on record for them.
Okay, good.
My Social Security account.
Yes, good. Good thing we talk about this. OK，
Yeah.
他就是说，就是跟大家说一声，就是还有OK， 他就说，其实大家也可以上网去看 ，OK， 大家可以上网去看，就是说他有一个social my I mean actually I think people can， 就是 My Social Security 的话了，它有一个网站是大家是可以去登记一个账户，然后你是可以去看到你每一年的那个点数的 ，OK， 我现在就是把它放在聊天里边，让大家可以知道。So I'm just telling them I'm posting the link for them so they can. Okay. So.
And also, Ping, like if people they're just a little bit short. Let's say they have like 35 credits or something. they want to really try to get to 40. So even if they get a little part-time job just to make enough to get the additional credits, it makes a big difference. And they're going to get Social Security, and it means some other things too. So if you're close to the 40, you want to try to get it.
OK， 他就是说，其实大家如果是只有35点，可是差几点的话，大家可以做一些就是兼职啊，这样子，就是真的去拿够这个40个点的。OK， 你看一下 ，I'm also sending them also the the link to the Chinese materials. OK， OK 所以 OK， 然后我看到有一条问题，就是这个纾困金还有失业金是不是记在？就像刚才有一个评论，就是说你这些钱是对，你是打税了，是有这个是报税的时候要报，可是问题是这些钱是里边没有扣这个 Medicare 还有这个 FICA 的这个税，所以它是没办法有一个点的。OK。So I answered that about the stimulus check and unemployment. They do not count. Those will not count as a credit because there's no tax.
Well, you're not basically you're not working though too. That's the thing. You have to work to get.
基本上是没有工作，所以这些钱是不是工作来的，所以是没有钱的。Okay. Okay. So this question, because she said there's so much to process, so it's better to get direct answer from you. So September gonna be 65, which is this one. But the permanent resident is less than 5 years. So does that mean that they have to apply for Part B now?
No, they have to. Well, they got to meet the 5-year requirement first.
Okay, so they cannot apply yet.
Right, they can't apply.
Is there gonna be penalty?
And when they're coming up on the 5 years, they should get in touch with us, like the month or so before.
Okay, is there gonna be penalty for that?
I'm sorry?
Is there going to be penalty?
Not if they sign up like right, when they become eligible. In other words, once they hit the 5-year period.
Okay.
If they let it go, then they're going to be subject to the penalty. Yes.
Okay. 这个 Ryan 叫的就有一个说走一份是65岁，可是拿路卡小于5年，是不是现在要申请 Part B？ 他说，如果你不够5年，你是不可以申请的。可是当你够5年的话，最好是5年之前1个月吧，就直接去跟他们联系 ，OK， 然后就可以去申请这个 B 部分。然后我说有没有罚款呢？他说如果是因为你不够5年拿不到的话，这个是不愧这个罚款的 ，OK，so 有一个人问就是40个点必须连住的吗？不需要，你可能中间今年你停了。可能只有2000块钱工资，你就可能有2个点。所以如果你之前是可能有30个点，加今年2个点 ，OK， 就是慢慢加上去的 ，OK， 所以就是断掉也是可以的。So someone asked like the 40 credit, does that need to be continuous? And I told them that if you only have 2,000 this year, you might only get one credit. So it's just accumulations.
Right. So in other words, it's 1410. Of earnings gives you 1 credit. So as soon as that's what I was saying, 1410 times 4 is a little over is almost $5,700. Mm-hmm. So if they work a couple months into the year and they already make that amount of money, then they're going to get the 4 credits. Right? It doesn't have to wait till the year ends. It goes like quarter by quarter. But yeah, so if they need it, you could get the 10 credits, the 10 years of work. You could actually do it in like 8.5 because if you do the tail end of 1 year and then work for 8 years and do the beginning of the next, you would have the 40 credits. So it's a cumulative year-to-year thing.
他说是每一年慢慢的累积上去的，所以所以是不需要连足的 ，OK？ I know it doesn't make sense, but what? Okay. So it just go back to Monica questions. So okay, but I think Monica, you also mentioned that you already passed the special enrollment period, right? I think Monica, you can actually unmute yourself to speak. Are you there, Monica?
Yes. Can you hear me?
Yes. So I think you passed the special enrollment period, right?
No, not special, initial enrollment period.
Okay, you passed the initial. So Richard, so she's the one who asked about like the form that the employer need to fill, but then they only fill the mothers but not the fathers.
Right. Right.
So we want to know what can she do? What can she do now?
Well, I'll tell you what she can do. Where is she located? Downtown Philadelphia?
In Northeast Philadelphia.
At Northeast?
Yes.
Okay. So you need to get in touch with the Social Security office and explain this, because something's not right there with the employer. That's, I won't say it's against the law, but there's no reason for them not to fill out that form. And we would probably make a contact with them to see what's going on about that.
Okay.
So you want to get with us at Social Security.
Okay.
You can get the phone number. You can get the phone number for the Northeast office off our website. You just put in your zip code and it'll give you the number, and you can call the Northeast office directly. Even though people aren't in the office, they're still able to take calls from home. So something's wrong there. We probably would need to speak to the employer and find out why they're not doing this.
Okay.
I never really heard of that, to tell you the truth.
Yeah, it's very ridiculous. Give us a very hard time.
Yeah, well, something's wrong. I don't understand. Something's really. I don't mean to laugh, but it's kind of funny that. What's the reason why they wouldn't do that? It doesn't make any sense to me at all.
Totally agree with you.
Okay. So yeah, I think it's just going back that it'd be good to really communicate. So yes, Social Security might ask you for that documentation, but if you cannot get it, it's always best to go back to them, say, I tried, and what is the issues? At least they can investigate, or they can offer you.
Yeah, we would get in touch with them about that. That's wrong what they're doing. So.
Okay. Thank you for your recommendation.
Okay.
OK，
OK，
对 ，OK 刚才就是说，如果是真的有，就是刚才就是基本上有一个问题，就是说，如果你跟这个社会安全局交流的话，如果你是申请什么需要什么文件，如果是没有办法拿到的话，我建议大家就是跟他们说 ，OK， 现在我是试过了，我是什么途径试过了，然后现在是什么问题，然后他们就会做一个调查，然后他应该会教你是怎么做的。So I'm just telling people just like a summary that if they get in touch with Social Security office, if they're applying for anything and they request any documentation, if they try and they couldn't get it, it's always good to communicate back to them and what did they do and what is the issue, so people can investigate.
Yes, for sure.
Yes. 对，所以就是就是不管是什么部门 ，OK， 你申请福利还是什么，没有这个证件的话，就跟他们交流就可以了 ，OK。Okay. Green card, permanent residence card. Okay, so this is the last question. Okay, 这个是最后一个问题啦。OK，就是说路卡就是远远不住40个点。OK，6月份已经65岁过2天够5年路卡怎么办 ？Okay, so permanent residence card is way far not enough for 40 credit. In June, already 65. So maybe an extra couple days, it will be 5 years.
Okay.
So what should they do?
Well, again, I'm saying if they're coming up on the 5 years and they want to get Medicare, then they should get in touch with us. I would say like the month before, because then we want to get them. We want to get them entitled. We want to get them entitled as soon as they meet that requirement. So. They need to get in touch with us, and the office will talk with them how they want to do the application and all. But that's what I would do. Just make certain you do it a month early.
就是刚才说了 ，OK 如果你路卡不够，如果路卡不够5年的话，因为你65岁，你还是其实提早就是联系他们这个社会安全局，他们会教你怎么做了 ，OK， 因为你经常来说65，你应该是要拿这个红蓝卡。Just want to clarify, I heard that people are saying. Social Security office are able to also put in the application for food stamp or Medicaid. Is that true?
I'm sorry, you said food stamps and Medicaid. What, with us?
Yes.
To tell you the truth, paying years ago, we were doing the food stamp applications. I'm not certain now. I don't know if we can do them or not.
Okay.
I would have to check on that. I don't know off the top of my head. Years ago we did. I don't know if we.
Okay, but how does that work for like Medicaid? So as you said, we can put in on the application. We can indicate another Medicaid cover the Medicare. So does that mean that you guys will also send application to Medicaid or the client or the?
Well, yeah. When they do their Medicare application with us, and we have a sort of a data exchange with the state. So we would run that through through the computer system, Say we have this person who only wants Part A if the state's going to pay it, and we would communicate that to them, and then they'd go back and forth with us on that. So, but that's when they're applying for Medicare with us, not the food stamps and Medicaid. To be honest with you, even if we took the application, the information has to go back to the welfare office, public assistance office. So you might as well do that part right directly with the public assistance office. If you're filing for Medicare though, and you don't have the 40 credits, then you can say to us, and we'll put it in the remarks of the application, I only want Part A if the state picks it up, and then we'll run it through our system with the state, and that'll be taken care of that way.
Oh, so that way, pretty much you guys will go to the Medicaid.
Right. If it's involving Medicare, Medicare, we will go through the state. Yes.
So the client does
I'm not certain exactly how that works, but we have a data exchange system that once the application goes through our system, the information is going to be transmitted to the state, and they should be getting in touch with the person or us or whatever, and we'll see if they're going to get covered.
Okay, yeah, because I just want to make sure. So in that case, the client doesn't need to just go to apply for Medicaid, because you guys will already do the data exchange, right?
Right. If they're applying for Medicare.
Okay. Okay.
So a lot of times what happens, Ping, is people, they know they want the Part B because it's only $144 or so. Mm-hmm. But the A, because if they're not insured, it's going to cost them a lot of money. So they're the situations where we have. So where they say, I only want it.
Even B, they can also ask to be the same thing, right? Like.
Oh yeah, sure, yeah. If they meet those income and asset limits for the state, they can have B paid for as well. Yes.
Okay. OK， 这个是非常重要的，就是跟大家说，有的人怕 OK， 这个红蓝卡联邦医疗保险是需要钱的 ，A 跟 B 都需要钱的。他就是说，如果你是不够这个40个点的话，你跟他们去申请这个联邦医疗保险 ，OK， 然后你跟他们说，除非州政府医疗帮你付这个钱，不然你不要 ，OK， 你是可以跟他们说，然后他们在申请表上面就是备注。然后他们就是会把这些资料跟这个州政府的这个医疗就是去交流 ，OK， 然后他们就直接，如果是他们愿意帮你付的话，你这个费用都不用付，你自己也不需要去重新申请这个州政府医疗。所以如果你是不够40个点65岁的话，我建议你跟他们协会安全局沟通，然后跟他们说申请表上面可不可以就是除非州政府帮你拿这个钱。帮你付这个钱 ，OK， 不然你不要 ，OK， 这样子跟他们说 ，OK。So this is a really important point because a lot of low income they worry, okay, I'm applying for Medicare, but then I have to pay. So that's actually stopping them. So I just kind of explain that you guys will do the data exchange. So there may be a case that the Medicaid will cover the costs.
Yeah.
Yes.
Yeah, they should always be in touch with us about this because, they're missing out. If they can get the state to pay for that, the big cost of Part A, if they're not insured, then they want to do that. Yeah.
对，那就是说
that's called that's sort of like a contingency application for A. We're saying I only want it if this happens, meaning if the state is going to pay it, and the state should pick it up if they meet the requirements. So.
对，所以他就是说到申请的时候，他们就是去把资料送过去。如果收入达到这个要求的话，他们是就可以帮你付这个保险费用，所以你就不用担心了 ，OK。所以你这个申请表其实是叫做一个有条件的申请表 ，OK。
Same thing. The other thing, a lot of times the state wants the person to be on Medicare because. If they're just on Medicaid and they're going to the hospital, then Medicaid is going to have to pay all the big bill. Whereas if the federal government is providing some coverage under Medicare Part A, then that would pick up like the cost in the hospital, and the state would save money. So even though it's a lot of money per month for them to pay the premium, heck, if a person's in the hospital for 1 week, it's going to be a big bill. So generally they want to pick up those people.
他就是说，其实州政府是宁愿你去拿这个联邦医疗的，因为如果你只是有政府医疗就是州政府医疗，你去医院的话，是这个账单是非常多的，他们也不愿意去帮你付，他们宁愿这个是从联邦的钱里面付这个账单的 ，OK so just want to my last question. If people are on Medicaid, okay, and they're 65. Okay, are they required to apply for Medicare?
Well, again, the state sometimes requires them to file because, as I just said, since Medicare is a federal government program, they would want the person to have Medicare to defray their costs somewhat. So that's who would want it more than us. Now, a lot of times we get alerts in our system that, hey, this person is 65 if we have some record, and we would sometimes get in touch with people, but generally the state is going to push them to file more than we would, you know?
Okay. 我刚才就是说
Is there a reason thing why someone wouldn't want to have Medicare?
Because people heard about the premium, they are scared, and they are already on Medicaid.
Yeah, but they shouldn't. Okay, but if they're a Medicaid person, they shouldn't be scared of that at all because if they're a Medicaid person already, then the state's definitely going to pick up any cost, you know?
对刚才我问他就是说，如果你是已经有州政府医疗的话，65岁是不是必须要去申请这个联邦医疗？然后他就是说，州政府很多时候是期望你去申请申请这个联邦医疗，就这样，因为这个是不同的钱，有一个是用州政府的钱，有一个是联邦的钱，他当然期望可以省他们州政府的钱，所以期望就是去申请这个联邦医疗。然后联邦有时候他们会跟这个联邦医疗就是这个安全局沟通，就是说有一个人应该是要申请这个联邦医疗的，所以在这里就是希望大家，如果你是不太清楚在60岁以上吧左右，你也不知道我要申请还是不申请的话，大家是可以联系这个社会安全局的。So I'm just telling people if they're 60 plus, they're unsure, unsure whether they should get Medicare or not. They should always just contact the Social Security office.
Yeah, sure, yeah. And like for instance, here's another thing. Suppose a person's on SSI and they don't have the 40 credits. They're on SSI and they're like 64. When they're coming up on 65, we Social Security will generally get in touch with them to have them file for Medicare because you know, Medicare is a benefit. Once you get it, you're going to keep it. Whereas Medicaid, you know, if something changed, you could lose your Medicaid if something changed in your life with money or whatever. So it's always good to have the two coverages if you can, you know.
That's a great point. You might lose the coverage. 他就是说，如果你是 SSI 的，如果你是现在是63还是64岁的话，还没65岁的话 ，OK， 如果你差不多65岁，他们也会联系你去叫你申请这个 Medicare。因为他讲的有一点是非常好的，如果你是州政府医疗，我们每一年都需要逐期的吧，对不对？有时候被他们断掉了，你也不知道，所以他就是就是说这个联邦医疗保险，就是你如果申请到了，你就不需要逐期的，所以这个是非常好的 ，OK， 所以其实也是对的，因为我知道很多人测完医疗去看医生，测完这个政府医疗就没有了 ，OK，I think this is really good point, OK，I think we are good for now. Okay, I already send my Social Security link and also the link to the multi-language site.
Right.
我已经在聊天里边，我现在再发一次，就是我在聊天里边就是有2个网站 ，OK， 有一个是 My Social Security， 就是说你可以在社会安全局里边thiết立一个档案 ，OK， 然后它就是可以去开。你就是可以看到每一年他们收到说你是报了多少税，有多少点，然后里边也会说你几岁退休可以拿到多少钱的 ，OK， 然后还有联邦医疗不是白卡 ，OK， 然后还有一个是中文的，有一个是有中文材料在里边就是非常好的材料在里边，大家可以看一下 ，OK， 然后我就是想actually one second，Okay. 然后大家就是如果是还没加我们微信的可以加，如果没有帮我填表的，麻烦大家帮我填一些这个会议表格，没有填过的如果填过了只是需要填名字跟电话。那么So I think we are all good right here. So we will be looking forward. Let me double check. I think next week's section, okay, is about the retirement and survivor benefits, right?
Right.
OK， 就是跟大家提醒帮我填会议表格，然后还有我们下个星期3同一个时间就是做这个退休，还有就是如果是微商的就是这些福利的 OK， 所以希望大家也可以上来听。还有如果身边有朋友的话，也帮我拉一拉他们进来，因为我是很难才邀请到 他们社会安全局上来的。我们也知道有时候打电话给这些政府部门是非常困难的，所以希望大家跟身边的朋友去分享我们 PCDC 发的资料。Okay, so I'm just telling them next week we have this topic, so I really want them to come back next week and maybe bring some friends to come. Actually today, just to let you know,
Right.
we have total 22, including you and me. So there's 20 people on the line listening to
Okay,
the
great.
presentation. So I'm hoping they can share the flyers and have more people. I told them, so it's hard to get you guys on the call sometimes, and sometimes when people call, it's hard to get through the line. So this is the perfect opportunity for them to ask questions.
Yeah.
Yes.
Very good.
Okay,
Yeah,
now,
and remember next week, you know, particularly that would be particularly good for people who are like in their early 60s or 50s. People are not yet, obviously not yet on Social Security, have to think about when they want to retire and all that.
OK， 他说下周的这个题材呢，其实对哪些50、60岁的人是非常好的，就让他们可以去想一想，究竟他们打算几岁去退休的。所以对，所以他就是提醒大家就其实就算不管是50、60岁，我因为有这个题材，就是我自己也听了，也是就是学到很多东西的。OK， so I think we are all good now. Thank you, Richard.
Okay. All right. Thanks. Good talking to everybody. Take care.
Yes, thank you. Take care. 拜拜。
Take care. Bye bye.
对，
Bye
我
bye.
现在就跟他说谢谢他了 ，OK。所以大家麻烦大家没有填表格，帮我填一下，就是把这个打开，然后才离开吧。打开了之后慢慢填吧 ，OK。谢谢大家啦。我忘记说这个 presentation 我是会分享的，可是我还没翻译完我要看看有没有可以帮我翻译完它。谢谢大家，拜拜。